Hi there and welcome back. Let's review malabsorption syndrome today. Malabsorption syndrome refers to a number of disorders in which the intestine cannot adequately absorb certain nutrients into the bloodstream. It can be macronutrients such as proteins, carbohydrates and fats, or micronutrients like vitamins and minerals, or both. Proteins, carbohydrates, fats and most fluids are absorbed in the small intestine. Malabsorption syndrome occurs when something prevents the bowel from absorbing important nutrients and fluids. The problems may be caused by inflammation, an injury to the lining of the intestine, or an intrinsic disease, one that originates within the body. Sometimes the condition may be the result of the body's failure to produce enzymes needed to digest certain foods or to adequately mix the food with the enzymes and acid produced by the stomach. So with that, what are the factors that may affect the digestion of food and cause malabsorption syndrome? So that includes prolonged antibiotic use, celiac disease, huge market in the food industry talking about the gluten-free diet. Let's move on. So the factors include celiac disease, Crohn's disease, chronic pancreatitis, cystic fibrosis, lactose intolerance, congenital or birth defects, diseases of the gallbladder, liver or pancreas. As I said before, damage to the intestine from infection, inflammation, trauma or surgery. And last but not least, the radiation therapy that may also injure the lining of the bowel. Let's take a moment to look at what is short bowel syndrome. Uncommon disorder, and this condition may be a birth defect or the result of surgery. What happens is this: the surface area of the bowel decreases and this hinders the bowel's ability to absorb the nutrients. Another disorder that may lead to malabsorption is tropical screw. This condition is most common in the Caribbean, India and other parts of the Southeast Asia. Its symptoms may include anemia, diarrhea, sore tongue and weight loss. The condition may be related to environmental factors such as toxins in the food, infection or parasites. How about signs and symptoms? If you are unable to absorb fats, you may have light-colored, foul-smelling stools that are soft and bulky. Stools are difficult to flush and may float or stick to the sides of the toilet bowl. If you are unable to absorb protein, you may experience dry hair, hair loss or fluid retention. And some of you may know that fluid retention is also known as edema. If you are unable to absorb certain sugars, you may have a bloating, flatulence, or explosive diarrhea. And if you are unable to absorb certain vitamins, you may have anemia, malnutrition, low blood pressure, weight loss, and even muscle wasting. So, what are the risk factors? It includes excessive alcohol consumption, family history of cystic fibrosis or even malabsorption, intestinal surgery, use of certain medications including laxatives or mineral oil, and last but not least, travel to the Caribbean, India and other parts of the Southeast Asia. Let's take a moment to talk about the diagnosis. Doctor may suspect malabsorption syndrome if the patient suffers chronic diarrhea, nutrient deficiencies, or has significant weight loss despite eating a healthy diet. So doctor may end up performing variety of lab tests that includes stool test, blood test, breath test, and biopsy as appropriate. How about the treatment? Needless to say, treatment includes dietary control and administration of vitamins and minerals. And if the malabsorption syndrome is secondary due to, say, lymphoma or carcinoma or pancreatic disease, etc., then of course the treatment is for the underlying disease. How do we underwrite? Correlate all these details and plug these details into your manual and follow your company specifics and pay special attention to any long-term complications. Okay, so let's take a break here and we'll meet again. See you soon. Bye now.